welcome everyone. I think we're going to go ahead and get started now, 3 minutes after the hour. Excited for you all to be joining me and the wonderful Emily Evans. I've known Emily now, gosh, a couple of years.
A little longer than that, I would think. 4 or 5 years.
5 years, maybe.
Yeah.
Not only is Emily a good friend, but she's a total badass in her own right. She's one of the best policy analysts that I know, particularly in healthcare. So we're lucky to have her today. I promised everyone on this webinar that signed up for this webinar that we're not going to dive too deep into specific policies, but more so, Emily, getting your perspective on how policy, and particularly healthcare policy, can influence a startup's business model. So what should founders be thinking about, be paying attention to when it comes to healthcare policy, so that they can prepare themselves to make better business decisions, shift up, pivot their business models if they need to. So that's kind of the focus of this webinar, this conversation. For everyone on the line, just some housekeeping before I let Emily do an even better introduction for herself. You can submit questions through either the chat feature at the bottom of your screen or the Q&A feature. I'll be monitoring that. So if you have questions that pop up and you want to have them asked, please submit them. We'll leave about 10-15 minutes at the end to make sure that we do have time for those. But if I see one pop up in the middle of our conversation, Emily, that's incredibly relevant, I won't hesitate to chime in.
Okay.
So with that, quick just introduction for anyone that doesn't know me or Jumpstart. I'm Eller Mallchok. I'm the managing director of Jumpstart Foundry. We're a pre-seed healthcare investment fund. We're based in Nashville. We're investing in, a large number of companies every year, aiming towards, 25 to 30 early stage investments every year. And we work with our founders to provide them with great resources, information, connections to customers, follow-on investors. Again, we're kind of strategic investors at that very early stage. So with that, Emily, I'd love for you to introduce yourself. Give us kind of your background, high-level overview of what you do and why you do it and what you love most about it.
Okay. So without starting as I was born a small child, but my background is kind of you look at my resume and you think I have just absolutely no attention span, because I spent the bulk of my career, and I have spent the bulk of my career on Wall Street. So I started working in financing for nonprofit, tax-exempt healthcare organizations, hospitals, nursing homes, that sort of thing, through a broker-dealer that ultimately was sold to Payne Weber and then UBS back in the early aughts. And that's where I spent didn't get started, but spent the bulk of my career. Being able to finance that sort of brick and mortar type stuff, we've really moved away from it, but is understanding the reimbursement trends and policies and the restrictions and regulation of the industry. It's just simply not possible to finance something like that without understanding it. Then my children were little, so I thought I would go home and after we were sold to Payne Weber, go home and play tennis, and that lasted 18 months. And I got drafted for office. So I served in local office for about 9 years, which doesn't sound very glamorous. And you're right, it's not very glamorous. But what it does is it teaches you the regulatory process and the lawmaking process and the political pressures that exist. And I don't care what legislative body you're working in. There's a reason we say all politics is local, because it is. And I got a really good training in how that works and be able to discern the political pressures. After that, I went and put those two things kind of together, and I started my own firm. And then about 5 years ago, I went to work for Hedgeye, where the role I play at Hedgeye for public investors, and the role I play Eller with you and Jumpstart, is to be a translator and a tour guide, to take the complicated and often Byzantine area of regulation and law, and try and turn it into something that you can use, that's actionable, and but not repeat what I read in Politico or the Wall Street Journal, but really try and understand the backstory. So one of the fun parts about the job is, one, there's not a lot of people who do it, so I I don't enjoy a ton of competition, and not very many people to blow my own horn have the experience I have, which is part political, part finance, part just street smarts. But what's fun about it is helping investors understand, and more helping companies understand, here's the direction things are going in. And with the Trump administration, elected Donald Trump, we had some pretty significant change in policy direction, and that policy direction is something that isn't going to be easily returned, or easily revised, just because of the way in which government, the slow pace of government. So I'm as I told you earlier, this is probably one of the most exciting times for healthcare investing these next 4 or 5 years than we've seen in my lifetime. The next 4 or 5 years are going to be really exciting, just because of the way in which we have changed direction as a nation, in terms of policy, and that's pretty neat.
Thank you, Emily, for your quick background. I do want to dive into kind of the meat of the discussion, which I briefed before we actually got started, which is, you obviously know, and you did a great job describing this, the nuts and bolts, the details, the Byzantine side of healthcare. In my my very blunt way of saying it, kind of the boring drudgery of policy. But I love it. And I love your work. But what I do want to do is, all the translation that you do for Jumpstart is incredibly valuable for me. And as I'm thinking about, one, types of investments to make, ways that I can help our existing portfolio companies navigate kind of the months, years ahead when it comes to policy, I would love, to take this time and have you do some of that translation for founders that are listening in.
Okay.
Why policy matters, how they should be, looking at it, researching it, thinking about it, and, the best way to access it, even though it is a lot of research, a lot of reading, a lot of work. So really lending your expertise as that translator. So with that, kind of my first question for you is, for those listening in, can you give us some high level overview of how healthcare policy is enacted, how it's changed, who is directly impacted, kind of who are the players, just to give everyone, again, that sense of when policy is made or when policy is shifted, changed, who are the ones that are going to react to it?
Okay, so there are three or four primary policy avenues. The first one is obviously Congress, and they have been very active in developing legislation, and particularly throughout the 80s and 90s, starting, of course, with the Medicare and Medicaid, but very active throughout the 80s and 90s. And then, but less so successfully, leaving aside the Affordable Care Act, in the last decade or so, because there hasn't been as much consensus in Congress about everything, but particularly about healthcare. The second path is regulation, and that's driven almost exclusively by the executive branch. There are things that they have to do every year, like set the payment rates for Medicare, do contracts and do contracting with states under Medicaid waivers, et cetera. And then there are new directions that they can take the country and Medicare policy in, as a way to lead all of health policy. And that's really been the most exciting area. The third area are the courts, which have a lot to say about this sort of thing, and I'll give you a good example of that in a minute. And then the last area is the states. who are to varying degrees, more or less aggressive when it comes to health policy. So those are the pathways. Most of, as I said, it's either law, and everybody knows how a bill becomes a law, and you can watch.
If you've watched
you can watch, the
Schoolhouse Rock.
Kate House Rock. But regulation is a little more complicated, also sneakier, because although it tends to signal years in advance to changes in direction, very frequently those signals get missed because the people who read regulation tend to be your lawyer, and the lawyer will produce a blog post or a white paper, and what they're focused primarily on is, how is the law changing? So they're not telling you about all the signals,
Right.
that are being planted in those regulations. And that's why actually reading all of it, as painful as it can be, and it can take days, is so valuable. The court decisions come and go. The Affordable Care Act, of course, is the most prominent of those. But ultimately have to pass through the regulatory pipeline too. And then the states, following there's a number of resources. The National Council of State Legislatures, for example, has some great resources on the trends there. And a way I like to bucket it is in trends rather than trying to keep track of, every piece of legislation that goes through the pipeline.
Yeah. And so that's fantastic. So what I would love for you to kind of suss out a little bit more is, again, that digging out or trying to fit the sneakiness of regulation. Obviously, you said it, it's a lot of work to do that. That's a lot of the attorneys digging in, taking a lot of time to read through new regulation, new law, and pulling out those trends. Is there, I had kind of a question later on, but I'll allude to it a little bit here. Are there ways that entrepreneurs can do some of that trend finding that doesn't require them to dig through, pages and pages of regulation?
Yeah, so there's this concept in government known as adequate notice. We in government don't like, believe it or not, I know you're going to find this shocked, we don't like to just drop something on the industry, any industry's head, and say, surprise. We tend to like to signal. So great example of that has been treatment of control of diabetes. It's become a big project of the Trump administration. And if you were just to read the speeches or listen to the speeches that Seema Verma was giving throughout 2018, you would have known, okay, she's looking for a way to address this problem, and kidney care is another one, where we saw a lot of speeches. So if you really just pay attention to what not the president, not the secretary is saying, but you come down a couple of levels, and they all get invited to speak, and present at conferences and so forth. Come down a couple levels, you start to see the machinery of the policy making in the works, and speeches are a really nice, cogent, succinct place to find that. And one of the things I always try and keep in mind, in government, you have one resource, well, you have two, but the taxpayers get annoyed on the second, which is money, but time. You have a limited amount of time. And so you allocate that time and the time of everybody in your organization or in your agency or your department in a way that gets the most done. And so if you're allocating your time to restructuring how we treat and control kidney disease in this country, and you're going to put it in a speech, by God, they're going to be doing something. And in fact, that's what happened. So that would be a little long-winded. I'm sorry there, Eller, but that would be a great place for just the layman to keep an eye on it.
Yeah, I mean, that's great. That answers pretty much my question on, how can founders stay informed in a relatively low lift way. Again, I don't ever expect our Jumpstart Foundry's founders or any startup founder, to be an expert in policy. But similar to policymakers and, administration, that, startup founders' most valuable resource is time, and money, but time, really.
Right.
And so, if they can find ways to see trends or pay attention to a specific, policy maker or organization that is going to be enacting some change, watching the speeches sounds like it's a fun thing to do at the end of the day when you're laying in bed and watch a recap.
Right. And I think that and you can use Twitter for this, Seema Verma always links, to her speeches and the text of her speeches. And, but one of the things that I would caution everybody against is, stay away from the facile explanations, when someone says, oh yeah, we're moving to value-based purchasing. Okay. What does that mean? what is that, and everybody's got a new definition of it, and it becomes, it's too easy an answer. You got to know exactly what those things are.
And that actually tees up perfectly. We had a question come in just somewhat on value-based care, and the question is, in your opinion, Emily, under a new administration, do you think progress towards value-based care will continue? I mean, that's, again, a pretty specific question, but if you're an entrepreneur, obviously asking this question, what's the best way to process that, think about it, and react to it?
Right. So if we can go back to the passage of the Affordable Care Act, and the Affordable Care Act was kind of the apotheosis of this notion that, if we could just stop all this, unnecessary care, these unnecessary tests in Medicare fee-for-service, for example, then we would save $20 billion a year, and poof, there we are. Everything's great. We've saved the system money. We've got healthier people, et cetera. That was the idea. And that was born out of a lot of work that Elliot Fisher did at Dartmouth and the Dartmouth Atlas. The problem with that analysis is that it relied almost exclusively on Medicare data, and particularly old Medicare data. There wasn't a lot of other data in there to tell you, well, that's actually not what's there. That does happen, but that isn't really all that the problem is. The real problem is everything's too expensive. It's just expensive. The prices for everything, and the prices are all over the place, and there's no transparency. So when you say, are we going to get back to value-based purchasing? My question is, well, how do you determine what value is? We don't know the price of anything. We don't know what we get for that price. I think that the Trump administration, and Seema Verma said this, the Office of the Inspector General has said this, the notion of straight up value-based purchasing using bundles, using ACOs, hasn't really been that successful. And it hasn't been that successful because the system is engineered for everybody to get paid a price for their service, and they're not willing to accept deflation of that price. That's the problem. And so what the Trump administration did is they call it value-based purchasing, which I find funny, and we're for value-based purchasing. But what they've done is they've suggested that, wait a minute, in order to get value, we need to have more competition. And so we want ambulatory surgery centers to do procedures that normally were done, that we prohibited them from doing, but they clearly could do. We want doctors to be able to do things that ambulatory surgery centers were doing because they can do them cheaper. We want price. We want price out there. We want everybody to know what the price of this stuff is. And they've accomplished all those goals. And not coincidentally, you're seeing, with COVID accelerating it dramatically, you're seeing these alternative ways of treating people, moving into that space, and they're going to bring that price down. Walmart Health, which is just quietly changing the world, one, rural health center at a time. you have, we know from earnings calls, ambulatory surgery centers, USPI, which is owned by Tenet, added, I think, 1,000 doctors this year, most of them during COVID. So those are the kinds of that value, and we're going to have value-based purchasing. It's just going to be a little bit more about price, a little bit more about access, and a little bit less about the top-down, hey, let's have these, and no offense to anyone who's running an ACO or value-based purchasing, but you're gonna have to adapt to a world where people, they want price, they want to know what
And they
the
want
price is,
transparency.
and they want to know what the outcome is.
Yeah.
I mean, I think one of my favorite Jumpstart companies is Bell. I mean, this very simple thing of doing
foot care at home, foot care and foot screenings.
Yeah, which is the saving millions in amputations. Retaining, that's value. And the price, of course, is quite reasonable for saving a health provider hundreds of thousands of dollars in amputations and treatment of sores and so forth.
Yeah. Well, so we can dive into some more of those, again, specific changes, trends that we're seeing. I've got some questions coming in about that. But again, as I promised to keep it, what should entrepreneurs be thinking about, and how should they, maybe shift their mindset about policy? It's not likely, and in my experience in working with our portfolio founders, it's not likely for the founder, the entrepreneur, the startup company to actually feel that direct impact from a policy change. Rather, they're feeling, the residual impact through their customers. So through the health system, through how they're messaging to their customers. I think that's incredibly important. And so again, need to focus on, one, what are the signals that, policy changes are having on your potential customers? And then thinking through, okay, how is that going to actually change the way my customer behaves? Are they going to be, strapped for cash? Do I need to rethink about my pitch to them? Or do I need to completely pivot and change who I'm actually selling to? I think that's really important as well. Do I have any, while we wait for Emily to come back, happy to take questions again through the Q&A and the chat feature. So I have a question coming in asking, clearly privacy and security regulations that flow to providers and payers, et cetera, impacts the startups building solutions for those environments. I think that was probably just a statement. Yes, that's true. Again, I think it's the statement for how entrepreneurs can actually navigate, navigate those changes. So it's going to be important to think through your business model, how and who are you selling to? So if you are selling into providers or potentially if you were selling into hospital systems, as Emily was talking about previously, maybe you should start thinking about how you can position this for ambulatory surgery centers. What are their incentives? What's changed about, what's different about selling into an ambulatory surgery center versus a hospital? Who are the different roles within those organizations that you can reach out to, et cetera? A lot of different things that I think founders, and particularly a lot of business development team members of a startup, are going to have to think about. So with that, I do want to move to kind of our question. I started to just talk about this topic, which I think most founders know, but clearly stating that policy change doesn't directly impact them, it directs their customers, and they're going to feel the impact through their customers. Whether, and I just gave the example, whether that means, as the example you just gave, okay, maybe they've been selling into health systems or hospitals or provider groups. Does it make sense for them to potentially pivot and look at ambulatory surgery as an opportunity, or, a potential new customer to break into? But really, I'm curious, Emily, what maybe you've seen, have there been any major shifts that have made that happen in companies or startups that you've seen, whether it's a specific policy change that's forced a company to pivot or shift, and just curious of examples of that, and maybe giving, some light to those listening of forewarning, here's how you can react.
Yeah, well, I think one of the, when you've got a startup, a new company, you're supposed to be doing this anyway, right? What problem are you trying to solve?
Yeah.
What are you trying to address? And I think if you kind of stick to that question, and answering that question, not just from the perspective, your perspective, and Silicon Valley is so guilty of this, and we love to, I think, make fun of them a little bit, but you need to understand what their obstacles are. So using COVID, which I'm using this as an example, and because it's not a temporary thing, I think we think, oh, we'll get on the other side of it and everything will be fine. Wrong. We've completely altered the demand structure of healthcare in the United States, for probably the foreseeable future. So if you're selling into a hospital, for example, what are the problems that they're trying to deal with? Labor, trying to fit as many people through a much narrower pipeline. How can you help them defend their entity, their provider type, from losing patients to other provider types, but understanding the policy headwinds they're facing. Now, one of the frustrating things about healthcare is it moves really slowly, and a hospital, there's a lot of people out there in denial, for example, but a hospital system may not be quite sure, I don't need to do that, we'll all snap back to normal. No, we're not going to snap back to normal, because we spent a lot of time, in this pandemic, but we also have all these regulatory changes. We have all these policy changes that are make it easier for your patients to flee to other places. So I think that you have to start from that point, before you go and think about specific point solutions and so forth.
Got it. I think in that, something that you and I, and a question that you and I had talked about earlier is, timing for that. So if an entrepreneur sees that this is, change is coming, obviously policy trends or, signals that are coming now, when is that actually going to, take place? When and should entrepreneurs actually be changing things or potentially positioning themselves for that change? And so when are signals actually going to be felt in the real world?
I use a 2 to 3 year time frame.
Okay.
It seems like in my career, things that get implemented or get signaled takes a couple of years for the market to realize, oh, that's a real thing. I need to pay attention to that, which is a luxury, a lot of competitive markets don't have, right? They have to respond pretty quickly. Healthcare is a little bit different. And you want to always kind of stay on guard against that futurism. Google Glass is going to change how we work in an operating room. Talk to a surgeon, they hate it. So those are the pace. Just the new great thing isn't. It's just, this is a highly regulated, almost encased in amber industry. That is less true today because of COVID than normal, but 2 to 3 years is kind of what I like to use as a time frame, and look for those little incremental creeps, along the way, those little incremental movements.
Yeah. And so following up on that, those incremental movements and, I like creeps, if you will, kind of the sneaking into bigger change. Do you think that warrants any sort of shift in how an early stage startup is pitching, selling, even not just to their customers, but to their investors? Is that worthwhile, or do you think it's somewhat of a distraction if it is just small and incremental?
Well, your first job is to generate revenue. So you're not supposed to be looking for that, that thing that's going to, create revenue 3 years from now. But because the policy is incremental and it is built on top of other policies, it's pretty straightforward to go, okay, I think if you sell into ambulatory surgery centers, for example, the administration, this administration has been signaling for 3 years now that is going to be a site of service that is going to be competitive to hospitals. Okay, well, right now, only a small number of procedures are done there. So if you have a solution like a scheduling solution for anesthesiologists or something like that, you want to be thinking about how your particular solution will scale and grow as that particular site of service scales and grows. And that, I think, is the way to think about it. Here, what problem can I solve here today? And as these changes happen, how can I be accretive to those changes in the future?
Yeah, I think that, I mean, as an early stage investor, we certainly look for that. So I like how you answered that is, the incremental change is nice to pay attention to, but getting distracted by might change 3-4 years down the road is somewhat of a red flag on my end of, like, if they're too early to this change or saying this is going to happen too quickly, I get a little hesitant. There's value in selling to the existing market and the existing kind of environment of the market, and slowly shifting that versus building a business model that's going to be serving a future, which again, we saw a ton of innovation with Google. I mean, Google Glass is probably an easy one to point to, but I'm seeing that too, just in other models and other shifts, in some ways, price transparency too. I saw a lot of companies, innovating around price transparency to 1-2 years ago. And as a startup, they're not going to survive because we're not quite to the point where price transparency is in full effect and full swing. And so again, for startups that are just kind of getting things off the ground, it's going to take time, money, resources to serve, to withstand and survive that. So what can you sell into the market now, into the environment now? And then you might have a great solution that's going to be better suited for an environment 2 years down the road. But I've seen a lot of interesting future applications that just aren't ready for the healthcare industry today.
Yeah. Well, one of the things that I really try and keep an eye on are the macro trends as well. You can have policy and regulation changing slowly, but we put on top of that a real and right now, we're in the middle of this big project to really try and understand how the confluence of events, regulatory changes, COVID, economic, disruption, how are those things coming together and changing the healthcare system forever? And we should have the first installment out next week on that. But the macro implications of healthcare are important. How many people are insured? How? Okay. Yep. And you see Medicare Advantage becoming the go-to because that's one of the few growth areas. It's also getting kind of penetrated. We've got an administration coming in that's kind of not as friendly to it as we saw under the Trump administration. You also look at the labor market. What are the concerns there? So having a really good understanding, of those trends are I think really important, and it'll help you understand why isn't the hospital returning my phone calls. I want to sell them this great point solution. Well, because they're under a lot of duress. That's why you need to, those are the things you need to understand.
Yeah. Well, I want to be thoughtful on time and do want to open this up to some questions from participants. So again, you can submit questions through the chat feature or the Q&A. Feel free to send in any questions that you might have and I'll field them. got one here coming right in quickly. So Emily, do you think that Medicaid may be more of a focus for the next administration, given the issue of health disparities? Interesting question there.
Yeah, I think health disparities actually are going to weave their way through the entire federal response. We have been super focused on cancer, as a country. And for example, we dumped a bunch of money on brain cancer. 17,000 people get brain cancer in this country. Meanwhile, millions get diabetes and hypertension. And yet we don't really fund research into those diseases. So I think, and because the profile of hypertension, diabetes has really gotten, and kidney disease really gotten raised as a result of COVID, I think we're going to see that change. I think Medicaid will play a role. I think Medicare Advantage will play a role, but I expect that this administration, and I mean, if nobody likes to say anything nice about the Trump administration, but I think we ought to be fair here, which is the focus on kidney care. So that's the first time, I think I've ever seen a federal, interest in that, interest in diabetes. Those are diseases that cost us a ton of money every year. And yet,
nothing's getting better. They're in fact, they're extending the lives of people, but extending their life and having to deal with it.
Right.
And manage it, but not fix it.
Be miserable while you're managing it.
Yeah.
So I expect you're going to see that all across the board under this administration, under the Biden administration. And I think that there's going to be a bigger focus generally.
Got it. Emily, just question internally here is kind of obviously it's top of everyone's mind of 2020. How do you think COVID will affect policy long-term? We alluded to this a little bit in our conversation, but I'd love kind of a more direct answer just on COVID and its long-term effects on policy in the US.
Yeah. So what COVID, and this is becoming a cliche, we're all saying it, pandemics or any kind of dislocation, they tend to accelerate something that's already going on. How many CEOs right now are thinking, oh, I don't have to pay for all those conferences.
Right.
I don't have to pay for, let's keep that T&E, down to a minimum. What I think the COVID is accelerating trends we've already seen. Obviously, telehealth is one we're all talking about, which is calling your doctor on the phone. Something as simple as that took a pandemic, to get us really behind it. But also, surgeons are getting trained through telemedicine. Pharmaceutical salespeople are talking to their clients about it through telemedicine. Clinical trials are being managed remotely. All of these things are creating and accelerating a lot of productivity in healthcare like we have never seen before. This has been an industry that has just suffered from no productivity growth for decades, and now suddenly, we're really seeing that. So I think that is probably the most important theme, and you can weave that theme into any area of healthcare that you want to weave it into. I think that another thing to keep in mind is the federal government has rained hundreds of billions of dollars on the system. And hundreds of billions of dollars, I don't care what we're talking about, is going to matter. We're accelerating vaccine development. We're accelerating, testing, diagnostics. This stuff of 10 years worth of stuff is happening in 6 months. It's just absolutely extraordinary. And then I think the last thing I would say, COVID trends to think about is that as that pipe into your hospital and into your doctor got constrained by his need to provide or her need to provide PPE, by the availability of nurse labor, et cetera, you started and you went out and looked for alternatives, whether that's at Walmart, whether that's at CVS, whether that, just to put a fine point on it, I saw some data last Wednesday. Hospital systems are operating around 85, 90%. Urgent care centers are operating about 130%.
Yeah.
So it spills. The demand is there. It's just spilling out. So it's an extraordinary time, and I don't think you're ever going to live through anything like it. And if you're a healthcare investor or a healthcare company executive, you're going to have the time of your life.
To put it lightly, it's been incredible seeing, the number of applicants that Jumpstart's had over the last 6 months. Just there's no lack of supply in innovation, that's for sure. And particularly as all of these shifts are happening and where care is provided, how patients and consumers are engaging in their own health and care, that's creating a lot of opportunity for new innovation too. It's exciting for sure.
Yeah.
I've got one last question for you, just so that we can keep this thing under an hour, which I always strive to do. Question really about kind of the impact of some weaving in social determinants of health, but also what does that mean for delivery? So question is, millions of underserved populations have respiratory conditions like asthma or COPD, and are often an impact of social determinants like housing. Yeah. Do you think there will be a focus on whole health, not just healthcare delivery, in the healthcare system, but all of the other determinants of health? Is there going to be improvement or new innovation around that?
Well, I think there already is, yep. And let's look at two barbells of that. The one of and Raja Agarwal was on Hedgeye TV a couple weeks ago, and he said it the best, which is, we get paid to do stuff. We don't get paid to do nothing. And when you're talking about, doing things, social determinants of health, or trying to address the environment in which someone lives that gives rise to asthma, COPD, et cetera, you really have to think about doing nothing medically. And we saw I keep saying nice things about this administration, but we saw, but it's true. There's some good stuff that's happened.
Yeah. But particularly in healthcare.
Yeah. But the allowing Medicare Advantage to pay for things in like wheelchair ramps so people can stay in their homes. That has been that's been a pretty big deal. Now we got to worry a little bit with acuity on the rise, because of this delayed care. Are they still going to do that to because of their medical loss ratio concerns? But still, you've seen that happen, or you've seen that started. I think there is absolutely a worry when we start leaning too hard on social determinants of health, that we give ourselves an excuse, that we give ourselves an excuse that, oh, well, they live in these particular conditions. They're not aware of, the nutritional benefits, et cetera. So there is from policymakers, just a little bit of the, let's not let everybody off the hook here. And one of the insurance companies, they want to be able to, code for social determinants of health. You start coding for somebody for social determinants of health, you're not going to fix it. You're just going to code for it and get paid for it. So it's going to be a balancing act. And I think we're going to have to, I think the Medicare Advantage solution makes a ton of sense, where you're looking at your case managing, each of those patients. I think more broadly, getting some more research done on, diseases that are prevalent in people living in poverty, like diabetes and hypertension. We'll go, stop being so obsessed with, a cancer that affects 17,000 people, 17,000 tragically, but still, we've got millions of people who are underserved in other areas. So I think it's going to take a bit of a balance right now, where the insurers are kind of leading the charge on it, but I think it's going to take some balance. I'll tell you one thing.
Yeah, I would say insurers and employers are leading a lot.
I was going to say, Eller, I never would have predicted this.
I know.
But employer involvement in healthcare has accelerated, not decelerated.
Yeah.
And one of the examples I was going to give is, One Medical, which is a public company now. One Medical, you pay them to do nothing. You pay them a fee, a subscription fee. It's your Spotify account, just like your Spotify account. You pay them $200 and to do nothing. But they are your primary care venue. And because you pay them a fee, you do not mind calling them up and saying, hey, how about this? So that's kind of high end velvet rope type stuff. I think Walmart is going to be perhaps a solution on the other end. CVS, your pharmacist, who is more accessible than your pharmacist? I think those are places where you're going to see healthcare get delivered more and more in the future and more effectively, because of that trusting. Most people who have chronic disease know their pharmacist, and they're going to have pharmacists are going to get more pathways, I think, to treating disease, particularly chronic disease.
Yeah, I think the trend just at large kind of is a bigger focus on receiving care and in some ways care for your whole self, the whole patient. Being a consumer and engaged in your own health that's a trend that's going to keep growing, and it's going to be happening through avenues like your employer, like your grocery store and your pharmacy, retail settings like Walmart. And so I regard, yes, you're going to see some of those kind of more traditional, delivered traditional healthcare services performed in those places, but also different types of services, whether it's nutritional counseling or behavioral health or, exercise and physical well-being, like that. There's this whole other, again, kind of consumer, the patient consumer trend that's going to manifest itself in all of these different areas that are outside of the hospital.
And do not forget, what's coming into focus here is a population of people who have taken pretty good care of themselves, and they're replacing a population did not take very good care of themselves.
Right.
Whether it's the food pyramid to blame or, our attitudes towards exercise, particularly as they pertain to women, that is a big change. But I'll say, Eller, before we go, anybody who has any questions and wants to follow up, it's eevans@hedgeye.com, and I'm happy to answer any follow-up questions you might have.
Well, great. Well, with that, Emily, thank you so much to all of the participants that have stuck through the multiple. Sorry to me too. So thank you to our participants for hanging in there with us through the in and out internet. We're glad to have you here. As Emily said, shoot questions, follow up to Emily or myself. You can find contact information for us on our website at jsf.co. Emily, thank you again for joining me. I'm sure I'll have you back here again. It's great.
Thanks, Eller.
All right. Thanks, everyone. Bye.